Johnson's vaccine is a third tool in the fight against COVID-19 for public health. Not all vaccinators can get it right now.
We also can't expect an extra 50,000 doses in the state each week because it won't be that way next week or the week after. Amanda Quintana has details on what's next for Johnson & Johnson.
Even though many people 65 and older still haven't gotten their shot yet, Johnson & Johnson vaccine is specifically being used for newly eligible school staff.
The state chose to allocate its Johnson & Johnson vaccine to local public health departments to help with educators and childcare vaccinations.
That's not because J&J wouldn't work as effectively on the older population. It just made things easier to give teachers one shot. But pharmacies and big healthcare systems like UW Health didn't get any J&J doses. Still, Dr. Matt Anderson says those vaccines helped everyone.
The benefit of having the Johnson & Johnson, even if we're not getting any of it, is it's part of the supply that's going out to other vaccinators. And so that leaves more of the Pfizer there for us.
Last week, about 171,000 total vaccine doses arrived in Wisconsin. Almost 48,000 of those were the first shipment of J&J. But we won't see any more J&J deliveries for the next 3 weeks.
They gave out everything that they had on hand, and now they need to ramp up production capacity.
But the pause shouldn't affect the process at Alliant too much.
We have been providing Pfizer and Moderna up until this week. We'll put that back into the mix once we no longer have Johnson & Johnson. It just means that you have to come back for your second dose.
Shipment should pick up again at the end of the month. At that point, UW Health is hopeful they'll be done vaccinating all of their 65 and older patients and ready to move on to other newly eligible groups like long-term care Medicaid patients.
We do have our non-frontline healthcare employees that we will be working through as vaccine quantities allow. And then we have essential workers.
Even with the expected drop in doses, Anderson says we're moving in the right direction.
I think there's a lot of good news out there.
Amanda Quintana, News 3 Now.